growth and progression of their cancer, as a side of just trying to improve their overall health and well-being. And so we think about things like immunogenicity and immune suppression. And environmental carcinogens and what infection.
Hi everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona, co-founder of Kidney Coach and Cargenesis supplement range to support people diagnosed with chronic kidney disease. And I'm excited today to be joined by one of my fellow Australian colleagues. So you're going to have to put up with a double Australian accent today. The beautiful Carla Wrenn. Carla is a naturopath. She's been a naturopath for over 22 years, but Carla has got a passion for treating oncology and long haul COVID. She's had a very successful clinic down in the beautiful Mornington Peninsula area of Melbourne. For those in the US who don't know where it is, it's definitely a holiday destination spot. And she's been caring for very complex cases for a very long time. I actually have known about Carla for a long time because she's very well renowned in our naturopathic inner circle, I guess. So she's always the one that everyone goes to ask questions about cancer. So when you have a patient come in like that, obviously you're going back and putting in all that low-hanging fruit of lifestyle changes and things like that. You'd also mentioned earlier on, before we hit record again, about the importance of the microbiome. That's something we talk a lot about at Kidney Coach because we know the microbiome and the kidney gut access. But talk to me about what you're seeing the role of microbiome in cancer, and is that something that is at the higher checkpoint of you looking at things when we're coming and looking at ways to help support this person through a diagnosis?
Yeah, so I generally think around about 12 kind of targets that I'm looking at when a patient comes for support in that chemopreventative way. So this is me trying to make a difference to the growth and progression of their cancer as a side of just trying to improve their overall health and well-being. And so we think about things like immunogenicity and immune suppression and environmental carcinogens and what infections they've been exposed to and perhaps what their microbiome has been doing, and a lot of other factors. And what I love about microbiome and cancer, but particularly bladder and kidney cancer and colorectal cancer and even breast cancer, and it really, the research is just growing. So if you jump on and type in kidney cancer or bladder cancer and the microbiome, you'll find published research on the species that are most likely to be present in cases where there is an active tumor, and species that are most likely to be present if the tumor is going to progress. And so that's really actionable information for naturopaths and other complementary medicine practitioners or integrative medicine practitioners, because we can test that and we can determine. And in colorectal cancer, it's so accurate now that they think that in the future this will be a screening tool. And so wouldn't it be amazing that along with the fecal occult blood test, you might also be able to send off your poop and have it screened for those species, and that be enough to red flag, okay, we need to do a colonoscopy. And it would be amazing if the same was available for bladder and kidney cancer. But now, once there is diagnosis, or if you think you've got someone who's at risk of that, assessing their microbiome and determining if they have some of these key species, it may be levels that are low, so a deficiency in some of the desirable bacteria and an overgrowth of some other key species, then we want to try and put a shift to that. And so assessing and addressing microbiome is a bit of a passion at the moment of mine, accidentally, just because there is so much research. And I think research is a hint in the direction we should go, especially when no one else is addressing it. So to my knowledge, no oncologist in Australia has yet said to my patients, maybe we should look at your microbiome. Yet the data is very, very strong. So before we chatted today, I looked up some papers, and kidney cancer and the microbiome had a great paper published in May this year. And so I'm pretty sure no one's been told about that paper. So that's there and we can action it. So it makes me really excited, because along with, reducing inflammation or changing their diet and looking at cell defense and antioxidant status, and how can we get, good circadian rhythm and, nutritional status and deal with genetics, like some of those are big things to deal with, but not to simplify microbiome, but it is an easier thing to address for us as complementary medicine practitioners because it's really in our wheelhouse.
Totally agree. I mean, it's something I do with my autoimmune patients. It's one of the foundational things. Check microbiome. 9 times out of 10, there'll be some compensation thing. We've got a bit of dysbiosis in there, and it's something that
Yeah.
we can do straight away to make sure we're resetting the immune system and heading people down the right track. Carla, thank you so much. I really appreciate you as a person and your time. If you want to know more about what we do, head to www.kidneycoach.com. You'll also find us on Facebook and Instagram and all of those social media platforms. Remember to hit subscribe and like. That way you will be notified anytime we put out more information. And if you have any specific questions for Carla, please put them in the comments below and I'll be sure to reach out to her and ask, or you can find a contact page on the websites that I've put in there. Thank you for being part of our community, Carla. Thank you again for everything. I'm sure we'll have you back to talk about other things. And enjoy your day. And thanks to everybody for listening. Bye.
Thank you.